Well, Asante Sana for keeping it Y254 this morning. A very good morning to you yet again. Shiko Kaitani is my name. Of course, joining my fantastic co-hosts every morning from 7 a.m. till 10 a.m. And of course, that is Barry Moses, Kalamival, Hilda Wadivi, and myself. Remember, we still want to hear from you today and every other day through our social media platforms, which are Y254TV, both on Facebook, not to mention Instagram, as well as Y254 channel on Twitter. If you prefer to text us, well, karibu sana. That SMS number is 22162. Please begin with the words YM254. Now, this being Wednesday, as always, we do like to engage you in health matters. And so today on our health check segment, we are discussing stoma. If you don't know what that is, well, you're just about to find out. So on this particular day, we're going to be discussing combating stoma wound and continence. We're also going to be discussing the idea of creating awareness about stoma, not to mention what the condition is all about, the importance of even having a support group if you are living with stoma, and of course the training that comes with it. Now, in studio with me today, we're very happy to have Dr. Eunice Ndirangu, who is head of academics at the School of Nursing at the Aga Khan University. Not to mention, we also do have Josephine Gashango, who is a stoma wound and continence nurse in studio. Karibuni sana, ladies. We're happy to have you.
Thank you.
All right, so let's take it from the top, right? And maybe this is where we can start off with you, Josephine. Can you explain to us what stoma is? Not very many people understand. They're like, what? What is that?
Okay. Stoma is diverting the waste from the body through another channel rather than passing it through the anal region. That is caused by a patient or a client has cancer, maybe a trauma, and then they are not able to pass stool through the right way. Right. So it's created through your abdomen. The intestines are passed through, and then that is what we call a stoma. In simple terms, for a lay person to understand, is diverting your stools to pass through another place rather than the anal region. Okay. Yes.
All right. So, Dr. Eunice, maybe you can tell us what really does cause this, because people in layman's language, like you had said, it's now living with a hole, right, from your stomach. What causes, give us the types of stoma that there are out there. And of course, like she had said, maybe you can expound on these causes.
I'll tackle on the causes mainly. Yeah. The main causes of trauma are injury through road traffic accidents and maybe gunshot wounds. Another common cause is cancer, particularly people who have colon or rectal cancers. Right. Yes. Okay. Normally, we find because of the change in terms of disease epidemiologies, as well as changes in lifestyle. If you have increased road traffic accidents and increased risk for injuries, then you find our cases for stoma are on the increase. Okay. Yes.
Okay. Well, we are going to ask you to send in your questions in case you do have those through that SMS number, which is 22162. I'm also going to ask my director to actually put up images so that we can get a better understanding of what stoma really is and actually what people who are living with this condition are going through and what they're, living with. But Josephine, tell me, from the cases you've come across, what do people really experience? What do your patients go through when, they find out that, okay, I have stoma?
Actually, in the social setup, there is a lot of stigma. When a patient comes out from hospital and has a stoma, nobody wants to stay with that patient. Yes. He becomes a baggage to everybody. Remember, now the stool is passing through outside, and it is being seen. Some people do not have even the stoma bags to contain the stool. So it becomes very difficult socially, economically, and those people feel that they are neglected. They cannot even go to social gathering, social groups. They leave even their jobs because they are not able to continue living with the stigma they are getting in their social setups. So when they are there out, they feel they are outcasts. And I would like to tell people it's normal. It's normal. Any patient with a stoma is living a normal life.
Because I think that's really what it is. Do you get situations where people feel like, okay, my life has changed, everything, you know, now is upside down, I can't, you know, wear what I want to wear because it's living with an extension now. You have a bag that's attached to your abdomen.
Very much.
Yeah.
And they feel like it's the end of life. But what we do in our setup, you let that patient understand. I always say, the earlier you meet that patient before they go to get that stoma, it changes the perception what the patient is thinking.
Right.
Because you prepare that patient before.
It's a mental thing. You have to have, okay.
Mentally, I have to accept I'm going to get a stoma. What is this stoma? Does it mean I will not do my work? Does it mean that everything has come to a stop?
Yeah.
No. They need to understand that it is normal.
Yes.
I can go to job. I can go swimming. I can go anything. I can do anything with a stoma. Provided it's not bleeding, I don't have pain.
Right.
And there are people there out who can help. So the earlier this patient is prepared, by the time they are leaving, they know how to deal with the stoma, how to fix the bag, how to clean the site, and then you teach them the minor problems they would have, like bleeding, the bag is leaking, the bag is not sticking. That helps that client to accept. And remember, it's the body image which has been distorted.
Yeah.
If I like wearing my jeans, I feel I'll never wear my jeans again, my t-shirt. But that is not the case.
Yeah.
We have improved products which are called stoma bags.
Yes.
And they are very good and comfortable.
Right.
You can do anything with them, even swimming,
Yeah.
bathing. If you are able to do that, you are good to go and do anything in your life.
Okay. All right. So I think one of the general questions, Daktari, is this temporary? Is it reversible? What can be done if someone really feels that, okay, you know what, I'd rather go for surgery, fix me, please?
I think it depends on the type of stoma and the reason why you have the stoma. Okay. There are instances where it's temporary, as you know, your other physiological processes are getting sorted out.
Yeah.
But there are instances where it is permanent. Like Josephine has pointed out, the key here is to make it clear to the patient prior to. There are instances where you can have a pre-arranged treatment to get the stoma done. But there are instances where, depending on the condition of the patient, especially in cases of emergencies where you find that a stoma might be put in theater before the client knows. Either way, we are suggesting that at the end of the day, it's the psychological preparation of the patient that is important.
Yes.
And that is what we focus on in our own training for the nurses who are trained for the stoma and wound and continence care. Is yes, the skills of how to take care of the stoma are important, but also the psychological component of the patient is really, really key.
Okay. Yes. All right. So going back to the issue of creating awareness, especially about stoma, right? And, you know, encouraging those who now have to live with it. What is, in terms of figures, what are patients looking at in terms of maintaining this? Is it expensive? When you look at even the way someone lives with diabetes, it is a very costly condition, right? And is the government really doing much to support your initiative?
I'll deal with our institution.
Yes.
Remember, this patient need stoma bags.
Yes.
With the stoma bags, there are some things you need, like powder, like other accessories, we call them seals to put around to keep that bag in position. I would say it is expensive, yes, if I go it alone.
Yes.
But we have support groups. And in Aga Khan, we have a support group which comes every second Saturday of the month, where the ostomates, people with stomachs, we call them ostomates.
Okay.
They come and meet and they give their experiences. There are also few companies who sell the bags at a cheaper price.
Okay.
So when we meet there, or when I have patients in the ward, I'll direct them where to buy the bags. I know it has been a challenge for many Kenyans, because it hasn't been so outspoken about stomas. Nobody remembers that we have patients of stoma out there.
Right.
Nowadays is when you can see some companies are bringing bags which are good. But there are also some other bags which are not good.
Right.
And if somebody wants to make money, they will sell them to them.
Oh, yeah.
That's why we in Aga Khan we have specific, and we have a support group where when they see me and they're in the ward, I'll direct them. I'll give them contact to where to go and get their bags.
Okay, so are you also, in terms of going out and helping communities or individuals who cannot afford this kind of healthcare, is the Aga Khan doing anything to actually reach out to individuals in specific areas, for example?
When I get a patient who is not able, we have our welfare. So we'll link them with our welfare in the hospital.
Okay.
But mostly the patient we get in Aga Khan. When I link them with the Stoma organization, World Kenya, they get their bags. They only have to pay 6,000 shillings per year. Then you'll be getting your bags.
Wow.
Yeah.
Okay, okay.
Instead of buying every month from a company which is stocking the bags, I think it's cheaper when you get to an organization, you pay a bit of amount of money, and then you get your bags.
Okay. All right. So, Dr. maybe now you can also address the angle of the government's role in terms of creating more awareness about stoma.
I guess as Josephine was trying to say, awareness is created and taken up when people notice that actually this is a real health issue and it is a priority for the time being. So from, I cannot speak from the perspective of Aga Khan. Aga Khan as a training institution, what we have tried to do is to draw in nurses mainly from far-reach areas so that we can train them on the program and give them the skills to go out there and lobby with their own counties and their own hospital managements, so that attention is given to this need. And most importantly, you can start to let both the healthcare workers as well as the community know, look, there is a way you can be helped. We have the skills, we have the training, and most importantly, we can empower you as well. So because as an institution, we may not be able to train everybody within the country, what we have done is to get nurses across the country, empower them with skills of trainers, so that they too can go out there and run trainings. And I think now we have some trainings that are going on, and in that way then, you in a small way start to raise awareness, even as we are waiting for this to be, you know, a national response to an issue.
Okay, so maybe let's expound a little bit more about this training that you do offer. How long is this course? Because perhaps, you know, this being a youth channel, we've got, you know, young people from all walks of life, different professions, different interests. Maybe those who are in the medical field could be watching this interview and saying, oh, okay, I had no idea that there is specialized training when it comes to stoma. So tell us about that training.
So we've been running a training in association with some Australian nurses who've come in over the years to you know, give us some support and build our own capacity. So the training runs across 8 weeks that are split in 4 weeks each, and there are 2 modules that are face-to-face. So the trainees come to Nairobi. We train them for 4 weeks. For the first module, 2 weeks they go to the theory classes, and 2 weeks is a clinical component. We also have a third module that is a sort of a distance learning component, where the student or the learner, using any of the platforms available, can be in touch with their tutors and, you know, continue getting that mentoring. With the trainers of trainers, the only difference or added component to that is the fact that now you're empowering that person to go out there and structure some trainings and, you know, adjust them or adapt them to the audience. For instance, are they training other nurses or other healthcare providers on how to take care of stoma, wound and incontinence, or are you training the youth, or are you training the community, or are you talking to patients?
Okay. All right, so my director actually has thrown a few questions at me. Maybe we'll be able to sample 1 or 2, and I think Josephine, this one actually probably will go out to you, and it's I think from Khadija. Yes, I hope I got that right. Khadija, who says, by the way, for someone living with stoma, what advice would Josephine give in terms of managing it? Tell us more about stoma care. That's a good question, actually. So at home, how do I take care of myself?
Okay, at home now you have left the hospital, Khadija, and you have a stoma.
Yeah.
When you go at home, I always tell my patient,
yes,
let your partner know what is happening. Actually, for me, I don't teach only the patient. I'll get a second person.
Oh, so you teach the family members?
The very closest person to the patient.
Yes, okay.
Either the husband or the wife. I'll teach both of them. If it's the daughter staying with the mother or the son staying with the father, vice versa. Because sometimes, remember, it's a condition, it's a disease. That's why you have gotten this stoma.
Yes.
There are good days, there are bad days.
Right.
So I may wake up and I will not be able to take care of my stoma. So at home, what I advise them, before you start caring for your stoma, you have to have some equipment ready.
Right.
You have to have a scissor, clean drinking water, no spirit, no betadine, no hydrogen peroxide. That's not a wood. Remember, we are talking of an nano replaced.
Yes.
So this is my ano region.
Yes.
And the way I go to the toilet, the same.
Yeah.
It's only that I'm using a bag.
Yeah.
So get a scissor, tissues, clean drinking water, and a stoma bag, and a waste bag.
Yes.
Such that now when I start taking care of my stoma, I'm sure that I have everything in touch. I will not keep on running. So I remove my bag, check on the contents which are there. Is it diarrhea? Is it loose? Is it hard stool? Am I bleeding? Then fold your bag, put it in the waste bag. Look at your stoma. Is the skin changed? Is there anything? Are there swelling? What is happening? Is the hole still patent where the stool is coming from?
Yeah.
Then take your tissues. There are people who prefer to use gooses. I have no problem with the gooses.
Yeah.
They can buy.
Yeah.
Put water in a basin. Then clean nicely your stomach. Dry.
Yeah.
Remember, the bag has to be cut to fit your stomach. If I cut a big or a small hole,
it will leak.
It will leak.
Okay.
It will not hold.
Yeah.
So when my bag is cut to fit, then, and my stomach is clean and the skin is dry, I fix my bag starting from downwards.
Right.
Then I slip in the stomach.
Okay. Okay.
So after that, I check whether my opening of the bag, because it has somewhere you close. Is it closed? I close and I'm good to go.
You're good to go.
Yes.
Okay. All right. We've got one here from Martin who says, what is your word of encouragement to young people who may be living with this condition and feel that probably, you know, they are not good enough, they're not welcome in society, and, you know, they are going to be judged for having this condition?
Thank you, Martin. Actually, what I do, I have as young as 28 a patient with a stoma.
Yeah.
And one thing I do with the young people, we first, if it's not an emergency, I'll sit with them. It's not the end of life. So in case it's a young person who has a stoma, what I do, I'll tell them the cons, the pros, the negative, and how now in the society. Go out there, let people know you can perform, you can do all what they can do. Do not feel intimidated because of a stoma, unless I go telling everybody who doesn't like to know that people have stomas. A stoma is nothing to worry about. You live your normal life. You can go for football, provided the ball does not hit you.
Yes.
You can go to anything. Your dances, Martin. Go there like any
like
other person.
Dances.
Yes. Go.
Yes. Yes.
And do anything which you can do as if you didn't have a stoma.
Okay. Okay.
Yes.
All right, Daktari, I think we can throw the next question at you. This one doesn't have a name, but the question is, do you have workshops, and what can young people do to help with advocacy of stoma? I like that. That's nice. Very proactive. Thank you.
Right. So at the moment, most of the workshops are being run by our TOTs in their respective areas. However, if somebody would wish to get more information from us, if they would like to know more about stoma, they can get in touch with us through social media. AKU Global, both on Instagram and Twitter, or AKU Nairobi, Kenya on Facebook.
And by the way, AKU is Aga Khan University. Okay, okay. So AKU Global
on Instagram and Twitter, and then AKU Nairobi, Kenya on Facebook.
Okay.
So we could always, you know, sit down and plan for outreach workshops where need be.
Okay,
Yes.
I think that would be great because, like you had said earlier on, Josephine, you know, there's not much being done to actually talk about this condition and how can we actually help people, you know that they can live a normal life even if you do have a stoma. But even as we wrap up, because I can tell my director is telling me we're running out of time. What are your final, rather your final message to those who are watching today?
Oh, my final message would be, we have county nurses who have been trained.
Yes.
I'm one of the TOTs. We have Homa Bay, Kisumu, Machakos, and Kenyatta we have MP Shah, Mombasa, Kilifi, and Maridi. So people should ally us with those if they are in the counties, and to say that stoma is not death.
Okay.
Having a stoma is only that it has been directed, your ways to come from somewhere else. It's like I have an amputation and I'm using a prosthesis.
Yes.
And I live the normal life.
Wow. Okay. All right. So ladies, can I say thank you so much for coming through? I really appreciate it. Of course, if you did love this particular interview and you do want to know more about this, you can catch our health check segment on YouTube on our channel Y254TV. All right. So that was definitely Dr. Eunice Dirango, who is the head of academics, School of Nursing at the Aga Khan University, and yet again, Josephine Gashango, who is a stoma wound and continence nurse in studio today to tell us more about stoma, what we can do about it, the condition, and of course how support groups are so important. Remember to keep interacting with us through that SMS number yet again, which is 22162. Please begin with the words YM254. Be sure to keep it Y in the morning. There's more to come.